This show is for entertainment purposes only. Do not mistake this show for medical advice. If you or anyone you know is in need of a dentist, please contact 480-391-0099 to set up an appointment.
Welcome to our podcast. Sit back and relax. Dental Works Podcast. We're gonna share some facts. We gonna raise your dental IQ at the Dental Works Podcast. We will guide you. Put out some bad jokes before we are through. Free information here just for you. Sit back and have a good time.
Today is July 1st, 2023, and this is episode number 123 of the Dental Works Podcast, the show about learning the ins and outs of dentistry from a patient's perspective. I'm Ted Work, and that over there is Dr. Terry Work.
Greetings and salutations, fine listeners and viewers.
Dental Works is a family dental practice based in Scottsdale, Arizona that has been providing cosmetic and surgical dentistry for over 27 and a half years. This is the second time we're recording the 123rd episode. We had a little bit of a technical malfunction.
He erased it.
No, it was
in commemoration of...
It was because we were running on batteries, and now we don't.
Are we
no
plugged
battery.
in?
We're hardwired, baby.
Hardwired, baby.
We're hardwired.
Who frickin' recommended that? I don't remember.
That was a good call, but it's not like you invented the concept
I didn't.
of
I
hardwiring.
invented the idea of telling you to do it differently so this wouldn't happen.
All right. Well,
however, so that's why Kristen was on the last episode. That is why I'm wearing an Oregon Ducks t-shirt.
yes,
In commemoration of her.
You're a little in the corner. You want to pull it?
You put me over here. Hold on.
No, I'm so sorry.
That's
Just
me in the corner.
Scooch over.
That's me in the spot.
Scooch over, REM
Light.
boy. There we go. That's a little bit
Losing
better.
my religion.
All right.
So yes, Kristen was on the last episode, and my father, I sent him the podcast, and he said she was delightful, and so
Yeah,
I
she's
totally
all right.
agree. She's all right. We are going to have a recurring thing
Segment is what they're called.
Yeah, a recurring segment with Kristen. It's going to be called Kristen's Corner. So we haven't told her yet.
Or
so it's
maybe
gonna be
some
exciting.
better name. If we come up with a
Kristen's
better
Corner is what it is.
name. Sure. Okay.
No.
I'm going to cut
Kristen's
all this
Duckbill.
in case we... All right. So today we are talking about... Are we going to talk...
We're rehashing.
Are we going to rehash?
We're actually rehashing two episodes and combining them together, and sort of, kind of. And they are because we had an email from a David M. And the question was, Dr. Work, how come I can't use my medical insurance for dental procedures? David M., that's a great question.
Some would say that your teeth are part of the body,
Well,
and that
so-
your body encompasses your health.
We're-
What do you think about that?
Well,
concept?
actually, we're going to start with a little bit of history. Oh. I was born in Grants Pass, Oregon at the age of 0. No. So,
billions
history-
of years passed before I
so
existed.
the history of dentistry, I'm not going to go into the history of dentistry. However,
I
we
don't know it.
things that happen. Here's one thing I noticed. I watched the last episode with the video cameras, and for some reason, I talk a lot with my hands like I'm Italian or something.
All right, okay.
I am not Italian. And
We
any
are
Italian
not- if
there's any Italian listeners that you talk with your hands.
I am not Italian. Terry Work.
So,
all right, go ahead.
So, a little bit of history. It used to be in the olden days, you would go to get a haircut and your tooth pulled. And so
Used to
dentistry,
be somewhat barbaric of a profession.
Right, exactly. Dentistry was outside the realm of normal medicine. And actually I was reading an article about it, and it said, I think it was like in 1883 or earlier than that even.
20 years after the Civil War. Okay.
Dentistry, somebody made the recommendation to include dentistry as a medical specialty, and it was denied. They didn't think it was important enough.
Interesting.
Anybody out there that's had a toothache knows frickin' dentistry is important. Well, and so as we all know, changing minds is difficult. And so over the course of time, they were separate. And one of the things here is I have a little article here I'm going to read from, and it just says 5 reasons why dentistry and medicine don't fall under the same category. And then the thing is, spoiler alert, at the end
don't spoil it.
Toward the end of this segment, we're going to be talking to you about how we are trying to bring them together. Because we think it's important.
So kind of getting to our conclusion here right quick. The thing is that we are planning on starting to bill medical insurance. Is that correct, or what's the deal here? Sorry.
Well, that was the spoiler alert.
Well,
there.
we got to tell them where we're going. We got to say we're going to this place. Here's the pathway.
So Ted is great at ruining things. I had a whole storyline planned. I was going to take you on an adventure.
I can cut it.
I was going to
take
you.
If you need to.
Let me take you on an adventure.
If you want
First
to, we
and
can
foremost,
cut here and go back.
First and foremost, dentistry is important because it can cause significant health concerns or health issues. It was rumored that Queen Elizabeth died from a dental infection. We have no proof of that because there was no x-rays back then. But we're acting like that is the case.
Yes.
Plus the fact I think she smelled really bad. She never showered, and she, instead of changing her makeup, she would just cake it on.
They didn't shower in the Victorian era?
Yeah, I don't know. Not very much. But what we're going to talk about
Hard
here
facts, people.
the email from a friend of mine, David M., talked about that. Why can't you combine dental, medical insurance, get better coverages, that kind of thing? And I'm going to just read you this list of 5 reasons dentistry and medicine don't fall under the same category.
These are from a website. So don't hold us to these. It's from a website we found, all right? This is not like we did a study to find out what these 5 are.
Well, no,
These are
it's
just
not.
generic.
No, this is just one. This is one website that talked about 5 reasons they.
Do we
think
want to
it's
say
different.
what website it is?
I mean, we can.
Just go for it.
It's called You First Dental.
You First Dental.
Everyone is important.
Check it out.
And so it's just an article, and I'm going to go ahead.
Maybe I'll link it in the show notes.
I'm going to go ahead and give you the guy's name that wrote the article.
If I haven't, you'll know I'm lazy.
Yeah. And it is...
it's not up at the top there?
Adri... Oh, no, it's a dental clinic. What the heck is the guy's name?
Go up to the top where top of it is.
It's not. It doesn't.
Okay, then it doesn't matter who the person is. Let's just talk about what the reasons are. All right,
so
5 reasons.
5 reasons dentistry is different than medicine.
Number 1.
Dentistry is a specialty.
What?
Such as eye doctors, neurologists, ears, nose, and throat, chiropractors, gastrointestinal, gynecologists, proctologists, and so on. Podiatrists and dentists.
Have you ever
That's
been
number one.
Just a little bit of a non sequitur? Have you ever had the cupping procedure? Are you familiar with
No,
this?
I don't
know what it is?
like hickeys.
I don't either.
I'm good,
and that's what it is.
That's what it's a hickey.
It's like
a rubber
it's
cup
an appliance
hickey.
that gives you a hickey.
Yeah, I don't know.
All right.
That's what your mom's for.
All right.
You're going to cut that.
And
dentist.
And we're back.
Number 2, dentists take care of something general physicians don't have time for. Well, here's what's so interesting is when I was going into the military, and I've told this story before, but I'm going to tell it again.
Sure.
I was going into the Navy. The physician that was doing my physical, the dental exam he went like this. Teeth okay? That was it. And I said, and then he looks down at the paperwork. He goes, "Oh, you're in dental school. That exam was kind of embarrassing." But the thing about it is that the oral environment, there's a lot going on, and physicians they've got their hands full doing their thing. No, they know the whole rest of the body. I only know this much.
That's why
and
they're specialists.
If you count Botox, I know this much, but not much more. But they got the whole rest of the body.
Number 3.
Aesthetics is a large part of dentistry. And so, there is a whole entire...
I can't imagine why.
Almost, I I think what it boils down to is it used to be in medieval times. People didn't care as much about, how they look necessarily. I mean, they did, but they just kind of thought, well, this is how my teeth look. My teeth are jacked up. There's nothing I can do about it. Nowadays, aesthetics is such a large part, smiling and all that kind of stuff, such a large part of people's, daily lives that
they weren't smiling a lot.
It's
in the
only
Middle Ages.
yeah.
Is that what you're saying?
They're covered with black plague and like
not a lot of
bird feces or whatever. I don't know. Back in olden times, it wasn't as clean. But aesthetics are a large part. People smile, and so they take that much more seriously now. And so there's a whole section of aesthetic dentists it's not a specialty officially, but it could be cosmetic dentists.
Is that what they're kind of called?
Everything I do is cosmetic, meaning I try to make it look good. But we have a broader range of things that we do.
Sure.
Number 4.
We've talked about brutalism dentistry. That's a funny joke I like to bring up every once in a while,
Brutalism?
where it's only function, and it's like Gary Busey's face.
Oh, right.
Anyway,
all these teeth do is chew. Number 4, education is different for a doctor and dentist. I like how they separated doctor. I'm not a real doctor. But doctors go to school for many years. They go to university, then medical school, blah, blah, blah. Dentists go to university, then 4 years of dental school, and the process is about 8 years. So it's a little, I don't want to say easier, but it's a little less time involved in being a dentist.
So the difference is that there's more of a like practicing, like you're in residency after you leave, right?
In
so
medical
there's
school,
more of a training after the fact.
I think there's more of a chance if you're a physician that you could screw up and someone could die than in dentistry, although it does happen. Sure. Dental infections.
Well,
we're going to talk about we talked about
but
Queen
like
Elizabeth.
just talking about like the training and like the schooling and all that. But that's kind of one of the main differences is that there's that continuous sort of like on the job residency,
right? Well, and the dental kind of equivalent to the residency is a general practice residency. People do GPRs that can be 2 years long after you get out of dental school. And we went into the Navy and got a lot of extra training.
Okay, all right.
However, to be a physician, and again, now, I mean, there's almost nobody that just goes to medical school and doesn't specialize in some way.
Okay.
And I mean...
And you guys didn't specialize.
We did. No, I'm a general dentist with specialty training in several different areas.
Dentist.
And that's the thing is... And I do dental surgeries and I do a bunch of stuff, but a physician, you can't just, like as a dentist, I can take training to place implants and that kind of stuff. And those are basically small, minor surgeries. And a physician can, I think, to specialize in doing those things has to go to a specialty training thing that's a lot more involved. And again, I think it goes back to the probability of somebody dying as opposed to, it's very rare in dentistry, although it does happen. Number 5, people don't always view dentistry as important as general medicine. And again, it reads here, this is the part that I find difficult to swallow. This is the dentist talking. I'm not just talking about patients either. People in general in the healthcare field, patients, insurance company, tend to think of dentistry as a low priority. Well, if you have a toothache, I'm here to tell you that you do not view it as a low priority. That's why we have DEA numbers so we can write prescriptions for pain medication and all that kind of stuff. And it's a little bit of a conflict there because they allow us to write really strong drug prescriptions, and people know that it can be quite horrific to have a bad dental condition. Yeah. However, we're kind of just viewed as not as, I don't want to say not as important, but just not as high of a priority as...
Which in some ways is understandable. And, like when people's lives are on the line, it's a lot more like a heart surgeon and a dentist. There's an obvious difference, but the usefulness of both is still the same
but then,
level.
I mean, what about the difference between a internist, just a physician, and a surgeon?
Sure. Exactly. I mean, there's always going to be...
Where do we lie on the pecking order?
Everybody has a different job.
Homeless person, and then dentist, and then what's below that?
The people who use their brain thinking usually have a better...
So what do we got? We got like brain
They're like, well,
surgeon.
I'm smarter than they are.
We've got
and the
brain
people
surgeon.
that do their hands are like, well, I do my hands better than they do.
And that's
it's
true.
all true. Kinda.
Well, it is true. And again, there's a hand-eye coordination component to being a dentist that
Yeah.
is not as prevalent in a physician. A physician, they could be really smart and be a great diagnostician
Be a
and that
klutzy
kind of
doofus.
thing. But can't tie their shoes. Doctor can't tie your shoes.
I got Velcro laces. I
I got slip-ons. I got my slip-ons.
Yes, you have lupus.
So-
I'm sorry,
My shoe fell off while I was telling you have lupus. So, but the point about it is it's really the roots of it are in historical. It has a historical component.
Yes.
And it just kind of held on throughout. And so physicians, and I certainly wouldn't say that physicians look down on dentists or anything. I don't really care. It is what it is. However, there's a lower priority placed on it because there is so much of a lower probability of having a serious medical condition associated strictly with dentistry.
Mm-hmm.
However, we flip that around, and people who have like cancers, different kinds of cancers, it has now been linked to periodontal disease. And so I always say that your mouth is the gateway to your soul. No. Mouth is a good indication of overall health.
Yeah.
Like I can look at somebody's mouth and tell you how much they have in the bank. No, I'm just kidding. I can look at someone's mouth and
predict their future.
and get a chance. And so I get out my tarot cards. I clean their teeth with we floss
See,
with
that's
tarot
how I
cards.
know. That's how I know you don't know it is because you said tarot. I caught
Tarot
that.
cards.
I thought I didn't catch
tarot cards. Are they tarot?
It's tarot. Yeah.
Have you
I think
ever
it's
had
French. I don't
cupping
know.
through a tarot card? Anyway, but the point
No,
is...
but I have had kinesiology tape on my tarot cards, which is
That's what I use to hold my tarot cards together.
Oh yeah.
Is
Anyway,
kinesiology.
go on.
You've seen that picture of that gal that's at that Ironman competition. Her whole back is covered in kinesiology tape, literally. And underneath it says, you might want to set this one out, Karen. Yeah. It's pretty funny. Anyway, back to what we were talking about. There's a this is just within the last 15, 20 years that we've found this out. And that is the combination of periodontal disease or the link between periodontal disease and other illnesses. And then the link of illnesses and back to dental issues. And a perfect example is diabetics always have typically have problems healing. Like if I place an implant on a person with diabetes.
All right.
Diabetes.
Okay.
It typically won't heal as well.
Yeah.
But that's also true for smokers. And we're actually doing a segment with Kristen about vaping and the dental ramifications of vaping. But that's another perfect example. Someone that smokes, nicotine has an effect on vascularity and some other stuff. But conversely, there's an issue between periodontal disease and liver cancer, kidney cancer, intestinal cancer, colon cancer, a whole bunch of different things. So when we
do you think those are correlative or
it's really, really hard to say
because I imagine people who are not taking care of themselves generally aren't taking.
That's the problem. But my point is, we've had patients come in and they were in need of dental treatment, and we have to get a medical release.
And they had a broken arm. Like, your arm's all broken.
We can't fix your arm until your teeth have been cleaned.
Yeah, my teeth are hurting real bad. I don't know. Sorry.
No. What's the deal with your leg all bent in a weird shape?
Oh, yeah, no, it's been like that.
Yeah.
I've been walking on it.
I've been walking on the end of my leg bone. Is that a problem? But no, the issue becomes, the issue is, now I forgot what I was talking about.
Sorry.
No,
I'm so sorry.
I was talking about, a medical release. So we have patients that come in and they have severe dental issues. However, we need to get a medical release because we don't want them to have an issue associated with the dental procedure and find out later that they had a heart condition we didn't know.
Sure.
And I can't tell you how many patients, I can count it on several hands, that...
How many hands you need?
Several hands. The number of times we forced them to go to a cardiologist and found out they had an underlying cardiac condition that could have been life-threatening. So like a real doctor, we're saving lives. No. So the whole point is trying to provide overall care for these patients, you got to look at everything, the health questionnaires, all sorts of stuff. You still thinking about the broken arm?
No, I'm
joke,
thinking about a different thing. I'm thinking of a different thing, but we don't need to talk about that.
No, we'll talk about it on the next one. These jokes are precious. But so what we were going to talk about originally was we were going to redo a root canal thing and combine that with the why is dentistry and medicine separate.
Sure.
And then we talked at first, and I don't know if you're going to cut it out or not. But we've started billing medical for dental stuff.
Sure.
And so what we're trying to do is bring the two together. And we found out billing medical insurance is a freaking pain in the ass.
Yeah.
It's difficult. Well, it's just different than dental.
I imagine that once you learn it and get all the whatevers and the things.
Here's the thing that I'm so appreciative of. My staff, they do whatever I tell them. No, they are.
That's how jobs work.
They are open to the possibility of providing better health care for our patients. And so that's just something we're adding. And that's different than a lot of dental practices. And we're just kind of doing procedures, starting off kind of slowly. We're not trying to bill everything. You know what? You have fluoride?
Hey,
no, that's medical billing.
You got to learn.
But we are trying to do that as a extra service.
So now, what are the? It's just slightly different. What are the restrictions or differences
it's
or whatever?
All different codes. There's dental codes and there's medical codes, and medical. Because we're only from here to here.
Based on
the rest of the body has lots of codes.
So can you? Sure.
Yeah.
So you guys are like subsection 27.
Well, right.
F
like
7B.
I cleaned your teeth, but I'm going to code it as an ingrown toenail.
Now, do doctors number the teeth differently? You have to learn like a different new.
They don't even know what teeth numbers are. No, real doctors.
The tongue is numbered, and they're like, "Well, how's that factor into the?"
No.
Anyway,
but again, back to the other. One of the things that a dental abscess, one of the things that can be a really, really significant health risk is a dental abscess. And as I mentioned before, Queen Elizabeth, the whatever, one of the old ones, was rumored to have died from a dental infection.
Dr. Terry wasn't much of a student, if you can tell.
History. We were in Athens, Greece, and I wish I'd have listened a little better in the 8th grade.
Look at these columns.
Look at those.
Wow.
What do you call those white things with the ridges in them holding up
why
villains?
are they all so naked? What's going on with that?
Okay, so
all right. Well, we're starting to build medical. We're gonna have Kristen on in the future to do a thing
for Kristen's corner. Or Kristen's whatever she's
or a better thing.
What's wrong with Kristen's corner?
Viral clips with. It's not very descriptive. It's just kind of like it could be any person with a K name could be that.
Kristen.
It should be like viral TikToks with Kristen, viral moment with Kristen, the World Wide Web of teeth with something like that. That's what I'm thinking.
Worldwide teeth.
I don't know. Anyway, we're gonna go to our favorite segment, which is Celebrity Smiles.
I hate this segment.
Yeah, we're
doing it anyway.
We're continuing on with the theme I had for the part 2 of the last one, which is more authors. So here we go. Their books are good,
Dan
but
Brown.
are their teeth good? No, the first person's name is Greg Bear. Greg Bear. This is a person that you read a book from. I've also read one of his books. He's supposed to be a good sci-fi author.
How do you spell that?
He wrote blood music.
Oh.
Greg Bear, like the animal bear, and Heads, and Eon, and the Infinity Concerto. Lots of different weird books. That one's about music. That's magic. That's not him.
I was going to say he's young.
That's Greg Brar.
I know.
You have an iPad. What the hell's wrong with you? Use the iPad.
Oh, I thought we already did Greg Bear.
No, we haven't.
Oh.
We haven't done Greg Bear.
Boy, I'm going to tell you what, man. The picture on his book is pretty old.
What do you got? What is it? Did you look for teeth?
Wow.
Did you look up teeth?
So I just looked up smile. Kristen recommended that. Did not work out, Kristen.
Well, sometimes it doesn't. You know what? That's okay. We're learning. Every day is a lesson.
Okay.
Hell yeah, dude. Greg Bear teeth.
Greg Bear teeth. And
Yeah, do smile. We might not be able to find one for Greg Bear. This might be an
No, it'll be all right.
NS.
It's right here.
Okay, yeah. Well,
yeah, Good
He
Lord.
passed away not that long ago.
Oh, well,
He's got
so
lots of good.
I'm glad I didn't make fun of him.
Well, no, he can
Did
still
he
have
pass
bad
away
teeth
from
and
a
die.
dental
He can
infection?
still have died with
Let's
bad teeth.
do celebrity
No, it's-
smiles for people that died from dental
I
infections.
think we kind of already talked about this. There aren't any. And if they were celebrities 100 years ago.
You don't have any pictures of...
Hey, you know what? Sometimes it's an NS. Sometimes we get an NS, man.
Okay, so this is Greg Bear.
Sure.
He's like a 4.
Okay, we're giving Greg Bear a 4.
Greg Bear a 4.
Now
But
the
that
next
book is great.
person,
Oh, that was Blood Room.
Blood Music.
Oh, yeah.
Was that one? He's got lots of cool books. Check him out. All right, the next author is one of my favorite authors. He wrote,
did you put a spot in for your book club or whatever?
I did before,
Yeah,
yeah. So the next one is a person by the name of Werner Vinge, spelled Vinge. Werner Vinge. He is an amazing author. He wrote one of my favorite books. It's called A Fire Upon the Deep. I have to read the sequel. It's actually a
Deep in the
prequel.
Sky.
The Deepness in the Sky is the prequel about one of the characters in Fire Upon the Deep. But A Fire Upon the Deep is one of the coolest sci-fi stories ever. Seriously, check out this book. I can't believe.
Okay, he looks like frickin'
They
Greg
look
Bear.
exactly the same. I know. That's kind of why I did it. They look basically
That's
exactly
so
the same.
funny.
But he also wrote.
He's
some.
a class 2, division 2 with
yeah.
laterals.
He wrote this other book called Marooned in Real Time. That's really cool. He's just got really cool sci-fi ideas,
Which
man.
is interesting because I was thinking as I was shaving, I don't know
Yes.
why. I was thinking about, genetics and how some people have bad teeth and some
Yes.
people don't care and that kind
Sure.
of thing. And it's just like whatever, thinning hair or big frickin' nostrils, whatever.
Okay.
It's a genetic component to dental. And I used to think, oh, just brush your teeth and frickin' shut up, But that's not the case. There are just people who they say, I just have bad teeth. And my first thought was, well, maybe you're just not brushing good enough. But the truth is, it's like any kind of genetics.
Some people don't brush at all and their teeth are fine.
Well, right.
And
then
so
there's
it's like,
some people that say, I smoke and I've never had a cavity. And I'm like, I
Yeah.
can tell from here you got gum disease. But they just don't know. And so, again, but the whole point
Sure.
of that is we're not trying to make fun of people's smiles.
Yeah.
Although it always looks like that. And it always kind of feels like
you are
that.
pretty judgmental, but
Well,
you know what?
I mean, we're doing...
This segment is where
It's the
we
only thing I
allow
know.
ourselves to be judgmental.
we allow
in this
ourselves
way.
some freedom to
exactly.
express our...
This is an implicit
snarkiness.
We have an
No.
implicit warning.
Well,
that it's not.
yeah.
It's not only to be mean. Let's say
Right.
that.
Yeah.
This is
We
is
like
an
to
exercise.
think that there is some redeeming quality. God.
Anyway, so what are we giving Werner
Well, he's
Vinge's
class 2
teeth?
div 2,
Oh, yeah.
so he's automatically a 4.
And he looks exactly like Greg
And he
Bear.
looks
and
like
he got
Greg
a
Bear.
4, so there you go.
Yeah, so and but the point being, he
Yes.
should get his teeth fixed. No,
Sure.
he
No,
could.
hey, you know what?
That's the thing about dentistry. And again, there's people that have like some kind of growth issue, but there's surgeons out there. You can get your jaw broken and moved out and stuff.
Yeah.
I'm not recommending that for this guy, but
So
I would-
that-
if he did that, I would read his book.
This author is the guy in the book. He has the coolest description of aliens I've ever heard. It's the one where they're like a pack animal and they all individually
right.
they talk to each other. It's super
it's
cool. You should
mental.
read it. It's so cool. It's sounds.
telepathy.
So they no, it's just sound. So the closer the heads are together, the better they are at thinking because there's less interference, and they can't get next to other groups because it messes up their brains.
You know
it's
who would
really
hate
cool.
this book?
Who?
Your mom.
Yeah. Oh no. Of course.
Yeah, it's not a hard.
All right, and the final person.
Oh, we got one more.
Is another sci-fi author. This is a classic sci-fi author. Her name is Ursula K. Le Guin. She wrote
I
some
think you're
really,
mispronouncing
really
that.
cool. Ursula K. Le Guin.
How you spell Ursula?
Ursula, Ursulak. Period. Le Guin. Leguin.
How you spell it?
If you,
L?
it should just spell sound it out,
L-E.
and it should come right up. There you go.
Legume.
She's very
Legume.
famous.
She's a legume.
I have one
Isn't
of
that like a bean or a pea or a legume?
Yeah, it's like a
Split peas.
root a carb. I have a book here from the library of hers that I'm very interested in reading, but she's written some very interesting books.
She's old.
Sci-fi usually with like an ethical quandary or some sort of like
my stories
theme
always
that
have
she's
some sort of moral.
No, it's just like
story.
There's some sort of theme that's running through it, and kind of she has a point to what she's saying.
She's
with
got
the
a
story,
nice
you know?
smile. She doesn't smile very much, but
She's got
a lot
excellent
of
stories.
She's got a lot of dental work. I'm gonna
yeah.
give her like a 7.
Not bad.
Actually.
It's not
Not bad at all.
Yeah.
I'm not
All
a big
right.
sci-fi guy.
She writes really interesting things that are like less about being weird and like, the spizbometer hooked up to the squimby-diddle and the, all that sort of bullshit. But she is really good at just like talking about how it affects humanity in a lot of ways and like what are the consequences of a planet that it's really cool. There's one called The Dispossessed where it's a person who's from a planet that's like communist, and he flies to a planet that's capitalist, and he talks about the differences, and it's kind of an analyzation of the different types of cultures and what the advantages and disadvantages of both are. It's very cool, but like in a sci-fi way, like if there was a whole planet that was like that. It's cool stuff, and sci-fi is a great medium to kind of explore those ideas.
Sure. Well, it's interesting because your mother and I watched a movie the other night that I think we should review.
Okay.
It's with the guy Thor. What's the actor?
Okay, sure.
What's his name?
I don't know.
Hemsworth.
Hemsworth. Yes.
There's the Hemsworth brothers.
Yes.
And the name of it is, we should review it because this is a dental podcast, The Extraction.
Yes. Wow.
Yeah. Well, actually,
Is
we
there
watched
any-
The Extraction 2. So I'm like, maybe he pulls a number 2 tooth. I don't know.
Those are hard to
anyway,
get to.
Yeah,
Those are hard to get
yeah,
to, so
second
maybe-
molars are tricky. Yeah. So with that,
All right. Well, with that, we are going to say thank you for listening to the Dental Works podcast. If you'd like to support the show, please give us a rating on iTunes or your podcast player of choice. And if you'd like to get in contact with the show or you have questions, please send an email to dentalworkspodcast@gmail.com. We may talk about your question on the show. If you're located in the Phoenix area and you need dental work, please give us a call at 480-391-0099. We will see you guys later. We'll have Kristen on the show, and she'll have her own segment that
happy flossing.
we figured out the name of. And also, we are moving right now, so the area might change. It might look different when we record the next one or something. We don't know or not.
Send emails to
dentalworkspodcast@gmail.com.
Yes, we would love your questions.
Or
Thank
Terry's
you, David
email
M.
if you have
Thank
Terry.
you, terrywork22@gmail.com. Either one of those would be just fine, but thank you, David M., for your question.
Yes.
Peace
See
out.
you guys in the next episode.
This podcast was produced by T-Door Productions. Theme song written and recorded by Neil Hathaway. Vocals by Terry Work. Sound effects provided by freesfx.com and zapsplat.com.